Good afternoon everyone. Today I will be presenting through siblings eye exploring a rare presentation of peripapillary pachychoroid syndrome. I would like to acknowledge the chief author Dr. Soumya and co-authors Dr. Prabhakar, Dr. Kavita and Dr. Shirpurkar. A 9-year-old girl, patient 1, was referred to Ophthalmology department for fundoscopy to rule out papillary edema. She had presented to a pediatrics OPD with complaints of headache and giddiness since 8 days and history of convulsions 1 day back. The child had one episode of involuntary jerky movements of the upper and lower limbs which was associated with posturing, uprolling of the eyeballs and deviation of the angle of mouth. Upon further review of the family history, the mother reported a similar condition in an older kid who is a diagnosed case of seizure disorder who also had complaints of diminution of vision. Patient 1 had no significant past medical history. Patient 2 was a known case of seizure disorder and was on oral brivaracetam 50 mg BD. Both the siblings were born out of third-degree consanguineous marriage. There was no history of seizure disorder in any of the family members. Case 1, extraocular movements were full and free in both the eyes with plus 0.5 spherical correction in both eyes improving to 6x. IOP was normal, was 12 and 13 mm of Hg right and left eye when measured with rebound tonometer. Anterior segment was normal with pupils round, regular and reactive. Posterior segment disc normal with CDR of cup disc ratio of 0.3, vessels were normal, but choroidal folds were noted present around the macula and the macula seemed to be dragged towards the optic disc. The same examination was noted in case 2 with full and free extraocular movements, IOP normal, anterior segment was normal as well with posterior segment disc normal, cup disc ratio of 0.3 and choroidal folds were noted in case 2 as well. On OCT macula, it presented a normal foveal contour with increase in the nasal neurosensory retinal thickness of 682 microns on the left eye and 632 microns in the left eye, with disorganization was seen in the inner retinal layer extending from the fovea to the temporal to the optic disc, and subfoveal choroidal thickness was around 320 microns. I could not have the access to the photos of it. In patient 2 as well, who is the sibling, similar features were seen in this patient as well with normal foveal contour, with increase in the nasal neurosensory retina, with
no torsion of the macula.
No, ma'am.
Because you said that there was dragging of the macula in both the cases.
Ma'am, the macula seemed to be more closer to the optic disc as it usually is. So when seen on fundoscopy, it seemed like the macula was dragged near the optic disc. The distance between the macula and the optic disc was reduced. Yes. Thank you.
One thing that you have evaluated your patients thoroughly. What other features you were present in your patients to label them as a case of pachychoroid?
Ma'am, usually in this age group, usually you don't present with a pachychoroid spectrum. It's usually in 20s to 50s. So in this age group, when we did an AIOCMT3 from another center, we got the choroidal thickness, subfoveal choroidal thickness of 320 microns in both the eyes and 330 microns in the second patient. So that is why we concluded that it might be a variant of pachychoroid spectrum.
Might be a variant, okay. Okay, please, next speaker.
Thank you.